All right, so we have a 50-year-old female. She underwent actually 4 days ago uh, multiple treatment at the same time. She underwent a little bit of thread lift because she felt there was a gravitation of her face going downwards, and she also felt that she had lost volume, so we had replenished her and gave her a little bit of fat, and we also did a revision low eyelid. She had it done roughly 10 years ago, and she felt that it served her very well, but she began to notice just the recurrence of the puffiness. And the point of today's video is that she had multiple treatment done all in one day, 4 days ago, and she's really healing very well, and there's very minimal bruising and swelling to speak of. So a lot of patients fear, oh, if I do this, if I do that, how long will the recovery process be? If done properly and with care and with meticulousness, the recovery is extremely quick. Wouldn't you agree?
Yes.
Yeah.
I agree.
Okay, so she's a very attractive woman, and she already looked pretty good. But let's go ahead and show her the side. If this is, let's go ahead and show the degree of jowling there, and just a lot of folding of fine wrinkles, and look how clearly delineated her jawline is. The jawline as it comes down underneath to the chin and neck area, and the improvement of the marionette line on the side of the mouth, as well as improvement of the nasal labial line. So you can sort of do like sort of a semi 360 and show how it looks. Okay. Now this is the left side. Let's do the same thing on the right side. Good. So once again, there's quite a bit of jowling there, as well as a obvious nasolabial line, and more important, underneath the jawline, there was quite a bit of wrinkling down there too, and you can clearly make out a nice delineation of an angle of the jaw all the way to her chin and how tight her chin looks. And this is all from just a well placement, well vectoring of thread lifting. And she did have an insertion point here. And as her previous video has shown on the day of the OR, on the day of the surgery, one of the biggest issues with doing thread is that there's dimpling and snagging, and as you can see, there's actually no sign of dimpling or snagging or bruising. So she's done really, really well from the procedure. And we always make it the point that we are aging in multiple ways. In her case, she had noticed that there was a return of the fat bag, making her look tired. She felt she works out nearly every day, and she noticed that from all the working out, there was deflation of her cheek area, as well as gravitation of her face, and all these things are happening all at the same time, and you need to provide a combination of treatment, and you hope that the combination treatment is the right formula that works synergistically. So by doing 3 different things, she's achieved an overall rejuvenation rather than just one focal area, making the other non-treated area look even older. So I think by treating her, the lower eyelid, by providing replenishment of a lost fat volume, and just ever so slight tightening of her jawline, there's very, very subtle but definitive overall improvement to the composition, the overall composition of her face. So how do you feel? Any particular pain anywhere?
No, I have no pain. I mean, I feel a little bit how do you call the
Where the thread is? Just when you open your mouth?
Right.
Yeah,
So
that would
that's
be
about
expected.
it.
Yeah.
No major pain. No, I think I'm healing very well and no bruise. Yeah, I'm very happy with the results so far, and yeah, I'm very happy with
Very
Dr.
good.
Kang.
Thank you
Yes.
so much.
Thank you so
All right.
much.